Section D of the post form records orders about the use of artificial nutrition.
For people who are not awake or who cannot safely swallow, it is possible to provide liquid food through a tube. The tube can be placed through your nose and into the stomach for short-term use. For long-term use, it would have to be placed in the stomach or intestines. This would require surgery. In general, artificial nutrition works best if you are otherwise healthy and are having problems swallowing due to a temporary issue you are expected to recover from, like surgery on your throat or weakness from chemotherapy. Food and fluids by mouth should always be offered if a person is able to safely swallow. Research has shown that for patients with advanced dementia, feeding tubes are not helpful in providing nutrition or lengthening life. Hand feeding can keep these individuals alive just as long and maintain comfort. A feeding tube is also not helpful for patients at the end of life. It is normal for a person to stop eating and drinking when death is near.
There are 3 options in this section. The first option is to select no feeding tube when patients do not want a feeding tube for any reason. The second option is for a trial of a feeding tube.
Some patients want a trial period to see if they can regain their ability to swallow or gain weight. If this option is selected, you should consider your goals for the trial period and identify how long you want to try it before revisiting the decision. The third option is for long-term feeding tube use. Patients with stable disease or disabilities that make swallowing unsafe may live for many years with a feeding tube in place.
Be sure to talk with your doctor or another member of the medical team about these important decisions and how they affect you. It can be overwhelming to figure out what to ask, so it's helpful to prepare ahead of time.